Good morning and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health. I know you've heard me talk for the past few years talking about Kaleida, but you know what? There's just a few things I would like to share with you. Number one, I want to make sure that you know that Kaleida Health, we are the hospitals. We're Buffalo General Medical Center, Gates Vascular Institute, Millard Fillmore Suburban, Oishei Children's Hospital, Visiting Nursing Association, which I always have to add. Visiting Nursing Association is there to meet the needs of you and your loved ones, infants through 130 years old at your home. And they're open 24 hours a day, 7 days a week. They have staff available. Also part of the Kaleida Health family or High Point at Michigan. Why is it called High Point at Michigan? Because it's that building located at the corner of High and Michigan. We have DeGraff Medical Park. We have several clinics, and they're all taking new patients. And we have several clinics for adults, for children, for men, for women, for persons LGBTQ, and that also includes transgender. Kaleida has over 10,000 employees, and if you haven't seen our commercial, Kaleida is currently hiring for all positions. For that, to find out more, you want to go on the website. Please go on the website and Google the Human Resource Department or call 716-863-8717. Again, that's 716-863-8717, and someone will be sure to give you the correct information. Also, Kaleida Health, Community Health Department, we continue to take part in person at health fairs and the health fairs that involve the community, involve employees, involve your church, faith-based schools. And although we are doing many of these outreach in person, we also have the ability to have speakers and such through our virtual program. And we have many ways of communicating virtually. If you have any questions again about outreach, please call 716-863-8717. And our radio program, the Great Lakes Health Radio program, we have over 5 years worth of programs. And I have to thank the person responsible for that, Joe Lipsham. And Joe is responsible for making sure that our radio program is taped every other week. So we have many of those. For more information, I do not have the website in front of me. However, if you call or email, if you email me at fmessiah, that's FMESIAH at KaleidaHealth.org, KALEIDAHEALTH, or call 716-863-8717. Well, okay, our announcements and updates on Kaleida are pretty much covered. So I would like to move on to our program for today, which is another very important topic I can't say enough about, and that is lung cancer. And our guest for today is Dr. Yoram Perry. Good morning, Dr. Perry. How are you?
Good morning, Francesca. I'm good.
Great. Thank you. And Dr. Perry is the Chief Division Thoracic Surgery, Clinical Professor of Surgery, and University of Buffalo Director of Thoracic Oncology with the Comprehensive Center within Great Lakes Cancer Care and Kaleida Health. That's quite a mouthful, Dr. Perry.
Thank you. Sorry. It's actually thoracic, which is the thorax is the chest in Latin.
Oh, okay. Thank you. And now, Dr. Perry, I know everyone, what is lung cancer? I know people think they know, but medically, what is lung cancer?
So lung cancer is it's a form of tissue. It's actually a cancer that forms in that lining the air passages, and it unfortunately is the leading cause of cancer death in both men and women. The two main types, we have the small cell lung cancer and the non-small cell lung cancer. And these two types basically grow differently and are treated differently. And the most common is the non-small cell lung cancer.
Okay. And I know we're going to talk more about what does that mean, but what causes is I know I remember years ago hearing about secondary smoke causing lung cancer, smoking causing lung cancer. Then I think we were talking about vaping causing lung cancer. And I guess now we even have a new category with the approval of marijuana, even smoking a lot of marijuana cigarettes. Do all of those areas I just mentioned, or and cigars, I think of cigar bars, do all of these things cause lung cancer?
Yeah, I'm glad you're asking this. Let's make it clear. So lung cancer can affect anyone, but there are certain factors that raise the risk, and the most important factor is smoking. Tobacco smoking really causing about 9 out of 10 cases of lung cancer in men and 8 out of 10 in women, meaning that in the earlier life you start to smoke, the longer you smoke, the more cigarette you smoke per day, increases the risk for lung cancer. So definitely it's smoking. Cigarette smoke is the number one cause for cancer. The second thing is, let's talk about secondhand smoker. We'll talk about spouses who are with their spouse who is active smoker and they inhale it by default. We talk about people who in their environment and work are inhaling cigarettes, and this can affect as well and can cause cancer, although probably not to the same amount of exposure, in a smaller amount, of course. Other reason for lung cancer can be exposure to other chemicals like asbestos, arsenic. Radiation can cause that. Radon can cause that, and definitely these are minor comparing to the main reason, which is cigarette smoke. You mentioned before, we talked about vaping and we talked about smoking marijuana. So vaping, it's not out yet, but we know that the heated vapes into the whatever the vehicle that the people are using it is not healthy. We still don't know exactly how much, and also it depends really what material is your lungs are being inhaled, whether it's some any oils or anything that are being heated that can change into free radicals that can go into your lungs and unfortunately can turn the cell into malignant cells. So it's not, we really don't know yet, but I believe it's almost like cigarette smoke, that only the knowledge about lung cancer came about 10 to 20 to 30 years after the cigarette smoke. I hope we won't have the same effect with vaping. Use of marijuana, THC or marijuana or CBD or combination, of course, of all. It depends. I mean, if you smoke it, you have the same hazard of smoke itself, the cigarette smoke, the fraction of the tar and everything which you inhaled in the lung can cause the same effect, whether you smoke marijuana or any other nicotine or any other thing. The THC itself, if you get it in a different vehicle, I'm not sure that's any relationship to lung cancer.
How about, and I'm just going to say cigars, because cigar smoking is becoming very popular. There are cigar bars popping up throughout Buffalo, West Side, East Side, North Buffalo, and people now have cigar rooms in their house. And I'm just wondering, and if someone's just visiting, hanging out with someone at the smoking bar, is that secondhand smoke? And does cigar smoking cause lung cancer?
Absolutely. It's just the same thing in different envelope. It has the same effect. Exactly. It has the same effect. You have the burning of the tar and all the bad material are being inhaled into the lung and can cause the changes and to cause lung cancer. I have actually many patients that never smoked cigarette, but they smoked cigars and definitely had lung cancer. So this is not, there's no difference.
And people are acting like it's such a great thing to do. Let's go smoke a cigar. I'm like, okay, but I don't say anything because
Well, I think the difference between people don't smoke like chain smoke cigars like they used to smoke cigarettes. So I think it's really a matter of the amount of smoking. I mean, the more you smoke, yes, the more you smoke, the more you're exposed.
And what are some, I always think of coughing as being a symptom of lung cancer, coughing and spitting up. Are there any other symptoms of lung cancer, or am I right?
Well, so you know that really the most common symptoms that we see of lung cancer is no symptoms. This is an incidental, no, seriously, it's an incidental finding of a smoker who went to the emergency room for a different reason, got a CT scan of his chest or a chest X-ray, and all of a sudden, oh, we found a lung nodule. You know, when someone has symptoms from lung cancer, which are like you mentioning, like cough, chest pain, coughing blood, trouble of breathing, wheezing, all this, when fatigue, when this has already happened, the disease is too advanced. It's too late. Because if you think about the cough, it's coming from obstructing of the air pipe, from irritation of the air pipe. It can be, you know, the trouble breathing. It means that your lung is being replaced by cancer. It is too late. We really don't want ever to wait for symptom for lung cancer to start treated. We want to find it early. We want most of the lung cancer that we treat today is being found incidentally. And for the luck of this patient, we found it early and we can actually cure them from cancer.
Okay. How can you find out if you have lung cancer?
So recently, actually, since in the last 10, 15 years, there is initiation of the American Lung Association, and that we do have to do surveillance for smokers or ex-smokers. So if you're in the age between 50 to 80 and you have 20 pack year smoker, and I explained it, meaning you smoke a pack a day for 20 years, or let's say you smoke half a pack a day for 40 years, or 2 packs a day for 10 years, together mathematics is 20 pack years, if it makes sense. So you're eligible for screening, meaning that now CMS, Medicaid, Medicare, the Blues are covering the screening, and you're eligible to go ask from your primary care to send you for CT scan printing in one of the radiology suite, and they do a low dose CT scan, very low radiation, but excellent, with no contrast. It's not painful, it doesn't hurt. You go, you get the CAT scan, it's been read by the radiology, and if they find any nodules, you're going to be seeing a thoracic surgeon for workup and possible surgery.
Okay. And that's well, and in some cases, surgery is good. It's not always a bad thing, right?
No, definitely not. Well, as a surgeon, I can tell you that, but, but you know, definitely when we suspect lung cancer, when we see a nodule in the lung, we send the patient for a biopsy. The biopsy can be done, you know, with a small needle, go through the body under CT scan or ultrasound. They found the nodule and get the biopsy. And if they found cancer cells, we need to make sure that the cancer did not spread anywhere, and we send the patient for more testing. If the testing shows that the cancer is localized and the patient in good health status, the best way to cure lung cancer is find it early and remove it early.
And something you just mentioned, you just talked about, is a great segue into Great Lakes Cancer Care Collaborative. Could you talk a little bit about Great Lakes Cancer Care Collaborative, which you are part of, and provide a phone number, and what types of treatments do they have for lung cancer?
Absolutely. So the Great Lakes Cancer Care Collaborative has all the aspect to treat, first to diagnose, then to stage and to treat lung cancer, also to follow up the lung cancer. We have the high-tech diagnostic tool. We have navigation bronchoscopy and a robotic bronchoscopy with the Monarch robot, which is very highly accurate to identify and to find these tiny nodules in the chest, in the lung, and actually find, even if you have a very tiny nodule, you come and go the same day, we take the biopsy, and if God forbid we'll find cancer, we will treat it. There are many ways to treat lung cancer. The best, as I mentioned, surgery. And when we do the surgery, we do it again with small keloid incisions. We're not opening the chest or cutting the ribs. With most of my surgeries that I do it robotically. So it's a tiny 8 mm incision, 4 of them. And most of my patients go within 2 days home after the procedure. Some of them even go the next day. The surgery itself, obviously, we have to make sure it's been done under general anesthesia because the patient is asleep. You can't operate on the lung while the patient is awake. And usually we have the patient has a drain, and after the next day or 2 days later, we remove the drain, the patient goes home. There are other ways. What if the patient cannot have surgery? Some people have some heart disease. Some people are very sick and cannot have general anesthesia. There are other options. We do have radiation therapy within Great Lake Cancer Care, and we send our patient to a specialist, and they can radiate the nodule. It's not as good as surgery, but the second best thing to do if you want to help our patients. Every patient that come to our cancer care is being discussed in a multidisciplinary team. We have in the multidisciplinary, we have interventional pulmonology. These are lung doctors which are specialized in lung function and in lung biopsies. We have interventional radiologists that do all the biopsy in the CAT scan. We have oncologists that are sitting and make sure if the lung cancer is more advanced, they actually advise and do other treatment like immunotherapy, biological therapy. We send a patient to clinical trial if we need to. We have obviously the radiation oncology, what I just mentioned about radiation, and as well as surgeons. And also radiologists that help us to read all these scans, all these CT scans that I just mentioned, and we go over all the imaging of the patient in order to make sure that the decision, it's a mutual decision. It's a team decision with the highest specialists of our system that sees every single patient, all the scans, all the information, and doesn't matter if they've been seen first by pulmonology, by me, the surgeon, or by oncology.
And I just want to make sure that the listener knows that that the listener is part of the team. It's not just doctors independently making decisions without you. You are part of the conversation.
Absolutely.
And I'm sure a family member, if they want to come along so they understand. Sometimes when you see doctors talking to you, sometimes you might become a little intimidated. Plus it's cancer. You might be scared. So I would say bring some along with you who's able to ask questions and listen and be your ears. And on that note, Dr. Perry, at what point should that family member, that person share should they share the diagnosis with the family?
Oh, absolutely. I always encourage my patient to bring someone with him, family member, someone they trust, somebody authorized to help them with any decision and to know this information. I think this is a lot of information to digest. Mm-hmm. I think that it's very helpful for somebody else in a second set of ears, because some people in the heat of the news are not percepting anything. They forget things. I always encourage to bring more. And also many of my patients has even my personal cell phone. And if they need, they can call back or call my office, and my physician assistant, my nurse will always call them and explain to them if they miss anything. And we can always meet again or talk before any decision about treatment. I also encourage them. I give a phone number to call for a family member or somebody interested to call, that can call over from a different city, from a different state. They can call back as long as they authorize it, and we can give all the information to our patients and their relatives, of course, because this is not an easy decision, especially when you have diagnosis of lung cancer.
And I know we are really running out of time, but is it necessary for the entire family to be tested for lung cancer if their loved one within that direct family member has had lung cancer?
So there is no much of a description of a genetic lung cancer. It's usually mostly related to, if all of them are smoking, definitely, but it's not because they're related to someone who has lung cancer, but because of a cigarette smoke. So it's extremely rare. There is no formal recommendation to check family member like breast cancer or like other cancer to be checked for lung cancer.
Is there any age around what, because you talk about smoking for 15, 14 years, 20 years, is there a certain age where, well, you have secondary smoke as well. So what's the youngest person you've ever seen with diagnosed?
So, I mean, the youngest I've seen is probably 16 years old, but that's also, you can have patient with on immunotherapy or immunosuppression that they have more tendency to develop cancer. But overall, people usually smoke about 20 years or 30 years until they really develop cancer or the risk of cancer is higher. That's the reason we screen the patient from the age of like 50 to 80. Most of the people, when they start in their early teenager, by the age of 50, they're probably smoking for 20, 30 years. So it's very unfortunate, but yes.
Yeah, and I have to share a funny story. Years ago, I remember my father said, he coughed up blood. Well, I guess when the time I was born, because he used to smoke up to 2 packs of cigarettes a day. Started young because it was cool for guys back then. But he said when he coughed up blood one time, he said he prayed to every single god. Every single god. He always said, including Zeus, that God, Dad, rest in peace. He's no longer here. But he said he swore he would never, ever pick up a pack of cigarettes again. And he never did, and swam for about 20, 30 years and had very healthy lungs.
No, that's great. I mean, also you have to know that cigarette smoke doesn't only cause cancer, it causes COPD, emphysema, heart disease. So there's a lot of other side effects for cigarette smoke. But for the purpose of today, definitely this is the main reason for lung cancer. And the best way to cure it is find it early. Go do screening.
Dr. Perry, I want to thank you. We haven't seen you. We haven't had this conversation in a couple of years, but we know people are diagnosed with lung cancer every day. And I appreciate your expertise in this area. And I'm hoping that this has impacted at least a few of our listeners out there who may think twice about putting their cigarettes or cigar or vaping down. If anyone has any questions, how can they reach you?
Well, they can call our office, which is 716-859-7937.
One more time.
716-859-7937. And they can always call, and we'd be happy to take care of any patient who has concern about cigarette smoke, about lung nodules, about anything related to thoracic into the chest. We'll be happy to take care of. And thank you very much for the opportunity to be here this morning.
Oh, you're welcome, Dr. Perry. If anybody wants Dr. Perry to be part of their program, please give me a call at 716-863-8717. Again, that's 716-863-8717. And I'll make arrangements with Dr. Perry so he can give this presentation of what we're talking today about lung cancer prevention to your group. So thank you. And I want to, all right, thank you, Dr. Perry. And in 2 weeks, God be willing, number one, in 2 weeks, our program will be talking about the Near East and West Side Task Force, Passport to Wellness in its 12th year at the Broadway Market, and that will take place the first Friday, beginning at 8:30 a.m. at the Broadway Market. And God be willing, in 2 weeks, you will hear my voice. And I am Francesca Messiah from Kaleida Health. Thank you. Be well and be safe. Have a good day. Bye-bye.